Welcome to the deep dive. Today we're tackling something huge, a topic that really touches everyone's life. The dramatic transformation happening in healthcare. We've dug through a lot of sources to bring you the cutting edge of how it's being reshaped. Think evolving consumer expectations, amazing digital tech, and of course the massive power of AI.
It really is remarkable the sheer breadth of these changes. Our sources, they paint a picture of this profound shift. We're talking more personalized, more accessible, and definitely more technologically advanced care. But, and this is key, they also highlight both the incredible potential and some very real obstacles we need to talk about.
Right. So our goal for you in this deep dive is simple, a shortcut. A way to understand this evolving landscape, what's driving it, what might be coming next, and crucially, the significant hurdles we absolutely have to overcome. It's about getting you properly informed, without getting totally bogged down in all the overwhelming details.
Mm,
So, okay, where do we even begin with such a monumental transformation? For me, it really starts with you, the consumer. You're stepping right into the spotlight. I mean, we've all come to expect hyper-personalization everywhere else, right? Retail, entertainment.
exactly.
Well, healthcare is finally catching up.
Absolutely. And our sources really underscore this huge move toward what they call consumer centricity. They
Mm.
take Gen Z, for example. Get this. A staggering 75% said they'd just walk away from a brand if the experience wasn't personalized.
Wow, 75%.
Yeah. And that desire for personalization, it covers everything. Custom workout plans, nutrition guidance, uh, interacting with AI chatbots, even choosing providers who might share similar backgrounds or values. Life sciences companies are definitely leaning into digital tools and AI now to tailor pretty much every interaction.
And here's something that really struck me. Patients are basically becoming like the CEOs of their own health.
hmm
That's not just jargon, right? It means you're not just passively receiving care anymore. You're demanding more control, more transparency, and frankly, a smoother experience like you'd expect from any service. And this also leads to a much broader, more holistic view of health, more focus on prevention.
That's a great point. Gen Z, again, they see health as integrated well-being. Physical, mental, emotional, it's all
Mhm.
connected. And they actually put their money where their mouth is, allocating something like 56% of their healthcare spending just to preventative measures.
56%, that's huge. So, okay, if personalization is the what, then digital health adoption is really the how, right? It's the engine making it all possible. And man, that engine is revving fast, partly, fueled by the pandemic experience.
Oh, definitely. The whole healthcare sector is just undergoing this incredibly rapid digital transformation. We're seeing this massive embrace of virtual care, telehealth, remote patient monitoring.
Telehealth exploded.
It really did. Telemedicine, for instance, is projected to hit nearly, what, $280 billion globally by 2025.
Wow.
That's not just about convenience, though. It's a seismic shift in access. It's democratizing health for millions who might otherwise be, left behind. And remote patient monitoring, RPM, that's using wearables, smartwatches, maybe sensors in your home IoT devices, sending health data right to your doctor.
Like my watch tracking my heart rate.
Exactly like that. And it showed really remarkable results, decreasing hospital readmissions by 15%, boosting patient compliance by 25%. Real impact.
And what about those electronic health records, EHRs? Often seen as, let's be honest, kind of static, clunky things.
Notoriously so.
They seem to be transforming, too, into more dynamic systems of interaction. Think intuitive dashboards, personalized recommendations, even real-time communication, all designed to actually engage you as an active participant.
And secure mobile access is becoming absolutely critical there. You need to be able to get to your info easily.
Right.
Which, speaking of mobile, brings us to the apps in our pockets. The North American healthcare mobile app market. It's set to reach almost $350 billion by 2027.
350 billion just for apps.
Just for apps, driven by things like RPM, online pharmacies, fitness tools. But, and this is really important to note,
All right.
only a pretty small fraction of these apps are truly professional grade and, crucially, high PA compliant.
IPAA, the privacy law. That's a big caveat.
It is. You need to be careful about what you're using and who you're sharing data with.
We're also seeing this huge surge in wearable tech generally, right? Smartwatches, fitness trackers, monitoring vital signs constantly.
Yep. And 5G technology is really becoming the backbone for all this. It vastly improves that real-time monitoring because it cuts down the latency, the lag time.
Makes sense. Faster data transfer.
And it's quite remarkable how even seemingly simpler technologies like voice-activated assistants, think Alexa or Google Home, and chatbots are changing access. Over 8 billion digital voice assistants are expected globally by next year. They can handle routine stuff, appointment questions, things like that, with pretty high accuracy.
And that helps accessibility too, right? For people who might struggle with screens or typing.
Exactly.
Yeah.
Especially for alternatively abled users and the elderly population. It makes things much easier.
Okay, this brings us to the real, maybe the biggest game changer, artificial intelligence, AI. How is AI enabling this hyper-personalized, proactive future we're talking about?
Well, AI and machine learning are pretty much foundational to hyper-personalization. They can analyze your behaviors, your preferences, your health history, but at a massive scale.
Yeah.
And doing that effectively, it actually helps build greater trust and engagement, believe it or not, if it feels truly useful and tailored.
Interesting. How else?
AI can also simplify really complex medical information. Break down the jargon, make it much more accessible so you actually understand what's going on. And zooming out a bit, AI-powered predictive analytics. This is huge. It's shifting the focus from just treating conditions you already have
Right, the reactive model.
to actively predicting them, using all that data streaming in from connected devices to see risks developing earlier.
So it's not just about what's happening to you now, but what might happen down the line, giving you and your doctor a head start.
Precisely. A powerful head start. And AI isn't just for the clinical side, diagnosis and treatment. It's tackling the back office headaches too.
Like admin.
Yeah, administrative burden. AI agents can handle appointment booking, prescription inquiries, 204/7. This directly addresses some of the healthcare workforce shortages we're seeing. It streamlines administration, and it can even help you understand complex things like insurance coverage and medical bills,
What would be helpful?
wouldn't it? And what's truly groundbreaking, I think, is the growth of digital therapeutics. DTX.
DTX, like software as medicine?
Essentially, yes. Software programs designed to prevent, manage, or treat a medical condition. Often prescribed just like a drug. They use AI for precision medicine, enabling continuous monitoring, detecting really subtle health changes, and personalizing treatment protocols based on your specific data moment to moment. The DTX market is projected for really significant growth.
Wow. And what about privacy with all this data analysis?
Great question. That leads to cutting-edge stuff like Edge AI and federated learning.
Okay, break those down.
So Edge AI basically means the AI analysis happens directly on your device, your phone, your watch, instead of sending your raw data to the cloud.
Keeps it local, more
Yeah.
private.
Exactly. And federated learning is a clever way to make the AI smarter without centralizing everyone's sensitive data. Many devices contribute learnings from their local data to improve the central AI model, but the raw data itself never leaves your device. It's a big step for privacy and security.
Okay, that's fascinating. So beyond the pure tech, we're also seeing big shifts in where the market's focusing and how social influences are playing a huge role.
Definitely. There's growing interest and, importantly, investment in previously underserved markets. Think women's health, menopause tech. Fertility solutions are booming.
Finally.
Right? And also senior care technology. These are driven largely by demographic shifts like aging populations. And you might have noticed this yourself, but Gen Z has this kind of DIY healthcare approach.
DIY, like looking things up online.
More than that, they're actively using online resources, especially social media. TikTok is a big one for health advice. Sometimes even self-prescribing based on what they see, discussing chronic conditions openly. Well, it's happening. And it seems partly fueled by dissatisfaction with traditional providers, maybe cost barriers too. It's a trend we have to acknowledge.
Okay. So pulling this together, what does it all mean for the actual patient experience? You mentioned phygital.
Yeah, phygital, a blend of physical and digital. It's becoming the norm. You want flexible communication options,
Yeah.
messaging your doctor, video calls.
But you still want the option for a traditional face-to-face visit when you need it.
Exactly, you want both. And let's be real, cost is always a major factor. High healthcare costs are pushing demand for digital solutions, for subscription models maybe, with more transparent pricing.
Especially, as you said, Gen Z often delays or just skips care because they can't afford it.
That's right, cost is a huge driver. And finally, tied into the personalization trend, there's this rising demand for culturally competent care. Care that really respects diverse identities, backgrounds. People want providers who can genuinely understand and empathize with their unique challenges.
Makes total sense.
So all these trends together, they really point towards a future where healthcare is much more proactive, much more integrated, and really precisely tailored to your individual needs and preferences.
That paints an incredibly exciting, almost sci-fi vision for the future of healthcare. Really powerful stuff, but
There's always a but, isn't there?
always.
As with any huge transformation, there are significant fault lines, maybe pain points standing in the way, and for me, the biggest, most fundamental one seems to be a lack of trust.
It's absolutely striking how much diminished public trust really impedes everything. And it often stems from, historical misuses of data, ongoing concerns. It hinders data sharing, which hinders generating new medical insights. So the critical question becomes, how do we balance the genuine interest in learning from data with the absolute need to protect people
Protect them from what?
from risks like privacy intrusions, exploitation, discrimination?
Yeah, people worry about very real consequences if their data gets shared improperly. Things like higher insurance premiums, maybe getting lower quality care, employers snooping, or even just feeling judged based on their health data.
Right. And simply telling people how data is used, like in those long privacy policies nobody reads.
Doesn't work.
It just isn't enough. Building that trust back requires a much more engaged, much more transparent approach. It's a huge undertaking.
Okay, so even if we can build trust, it seems the data itself presents, a colossal challenge. Data quality, data accessibility, these are massive hurdles.
Yes, absolutely. There's just a pervasive lack of accurate and complete data across the board. For example, sources point out many maternal deaths go uncounted or get incorrectly recorded. Care processes are often poorly documented. It's patchy.
And if the records aren't standardized,
That severely contributes to poor data quality, inaccuracies. It fundamentally undermines evidence-based decision-making if the evidence itself is flawed.
so just imagine trying to use that kind of data for the hyper-personalized care we were just talking about.
Exactly, it falls apart. And those EHRs we mentioned, they often come with really frustrating information accessibility problems. You hear things like too many clicks, too many tabs, problems browsing.
hmm
And I mean, many of us have probably felt that frustration trying to get our own medical test results, right? Chasing down a doctor's office?
It can feel like pulling teeth. And think about medical record abstraction. That's where STAP manually pulls specific data points from messy clinical notes.
Sounds error prone.
Hugely. Our sources show it can introduce errors at a mean rate of 960 errors per 10,000 fields.
Wow, that's a lot of errors.
It is. Add to that data duplication, inconsistencies between systems, and often a significant lag time between when data is collected and when it's actually available to use.
Yeah.
The data infrastructure is often just not up to snuff.
Okay, so even if the data is there, and maybe even accurate, the usability, the user experience of these health IT systems, it sounds like a frequent source of immense frustration for everyone involved.
Oh, poor EHR usability is a constant theme, a recurring nightmare for many clinicians. Physicians in Finland, for example, reported that EHR usability actually didn't improve between 2010 and 2017. In some cases, they said it got worse.
Worse, over 7 years.
That's what they reported. And patients can suffer too. They can experience increased anxiety from just information overload when trying to use e-health services or patient portals. So the critical question is, if the systems are so darn hard to use, how can they possibly support better, more efficient care?
Right, and you see specific complaints about patient portals, things like limited or weird security questions you can't remember, difficulty with font size or colors, allergy lists that are just text, you can't click them or update them easily.
Static information.
Yeah, and unclear notifications, you don't know what's important. And for doctors, managing medications electronically, e-prescribing can apparently lead to huge frustration because of complex logic, difficulties handling conversions.
It's not as simple as just typing it in, and the consequences can be serious. For you, the patient, it's actually pretty common to leave an appointment feeling uncertain. Uncertain about why you need a medication or exactly how to take it correctly, even after it's been prescribed electronically.
Communication breakdown despite the tech.
Sometimes because of the tech. And even newer stuff faces issues, like some users report discomfort with head-worn augmented reality displays in medical settings. Usability is key.
Okay, so let's say, hypothetically, we get great data, we build user-friendly systems, but if they don't talk to each other, what does that mean for integrated care?
Interoperability, or the lack thereof.
Exactly. That brings us squarely to interoperability and integration issues.
And it's a striking problem. Digital health systems are so often deployed in silos. They don't connect. This is particularly noted in contexts like Africa, but it happens everywhere. They lack interoperability, lack integration, and the result, fragmented patient records. You go to a specialist, they don't have your primary care info easily.
Your data is scattered everywhere.
Exactly. It limits tracking services over time, and it puts this immense burden on health workers who basically have to manually bridge these data gaps, chasing down faxes, making phone calls.
So much for efficiency. Our sources indicate there's often just no proper interoperability framework in place.
Right. No common standards or rules of the road.
And electronic referral systems, which sound great in theory, are frequently not connected with other crucial systems, like the main EHR or hospital systems. It hinders efficient data exchange.
And zooming out to the bigger picture impact. Deficiencies in communication among health professionals, often caused by these system issues, and a lack of clarity in medical records. These are cited as major causes of medical incidents and errors.
It's a fundamental breakdown that directly impacts patient safety. That's sobering.
It really is.
Okay, beyond the purely technical issues, data usability, interoperability, there seem to be profound systemic challenges too. Regulations, money, and just plain old resistance to change.
Yes, the systemic barriers are huge. For instance, the financial penalties associated with data breaches, while necessary for privacy, can actually act as a significant impediment to data sharing. Organizations become risk-averse.
Afraid of getting fined if something goes wrong.
Exactly. And here's a massive regulatory gap.
Hmm.
Many of those third-party health apps we talked about, they're often not covered by HIPAA.
Really? Even if they handle health data?
If they're direct-to-consumer and not provided through your doctor or hospital, often not. This creates huge liability concerns for health systems when you, the patient, choose to share your hospital data with those apps. Who's responsible if that app gets breached?
That's a mess. And financially, you mentioned incentives are often misaligned.
They're deeply misaligned. The dominant fee-for-service reimbursement model, where doctors get paid for each test, each procedure, rather than value-based care, which pays for good outcomes.
Right.
Fee-for-service can actively discourage data sharing. There's often no financial reward for the time and effort it takes to coordinate care or share data effectively.
Plus, it's no secret that healthcare IT projects, they frequently run way over budget and fall way behind schedule.
Absolutely. Gobbling up precious, scarce resources that could be used for, actual patient care.
Which then leads to the question, how much does it cost just to fix bad data?
It's staggering.
Mm.
The fear of submitting inaccurate data for, say, regulatory approval of a new drug leads to these extensive, incredibly costly data cleaning processes. Sources estimate that can consume 10% to even 30% of a clinical study's entire budget.
30%. Just cleaning data.
Just cleaning data that should have been captured correctly in the first place. It's a massive hidden cost of poor data systems.
And then there's the human element, organizational cultural resistance.
Oh yeah. Healthcare entities sometimes treat data like a monetized commodity. They see it as a competitive asset and are reluctant to share it, even for patient benefit, because of market competition.
Data
Pretty much.
Yeah.
And we also see poor adoption of things like electronic referral systems among, say, family physicians. Sometimes it's because they weren't engaged in developing the system, didn't get adequate training, or just doesn't fit their workflow. Resistance comes in many forms.
Okay, finally, wrapping up the challenges. Are there any specific tech areas that maybe haven't quite lived up to their promise yet, or perhaps introduced some new unexpected wrinkles?
There are a few examples. Mobile apps designed specifically for opioid management, for instance, are still pretty much in their infancy. They have limited user ratings, often lack evidence-based content. The potential is there, but they need more development and validation to be truly effective.
Okay.
We also see patterns like an overuse of MRI scans and maybe an underuse of simpler x-rays for assessing knee pain in older patients.
Why would that happen?
Sometimes it's driven by patient expectations. I want the fancy scan. Or maybe by long wait times to see a specialist, so the primary doctor orders the MRI preemptively. It's not always the most efficient or evidence-based path.
Gotcha. And even simple things like the EHR system just going down.
Right. EHR downtimes, they happen. And studies show they can have measurable negative effects on things like hospital pathology processes, lab result turnaround times. It really highlights the urgent need for robust IT emergency plans, backup systems to absolutely ensure patient safety during those inevitable outages.
Can't have the whole system grind to a halt.
Definitely not. And lastly, smart home technologies. While they offer convenience and potential for remote monitoring,
They also bring up huge privacy flags.
there are massive privacy concerns,
Yeah.
especially regarding video cameras, microphones, sensors collecting data within your own home. It immediately brings up critical ethical questions about consent, data security, how that data is used, and frankly, the usability of these systems in a sensitive healthcare context. It's a tricky area.
Wow. Okay, what a deep dive, truly, into this fascinating, incredibly complex world of healthcare transformation. From that amazing potential of a hyper personalized, AI driven future, down to the very real, very gritty challenges of building trust, ensuring data quality, and overcoming all that systemic resistance.
Yeah, zooming out, it's just abundantly clear, isn't it?
Right.
While the future of healthcare is incredibly promising with all these advanced technologies, achieving that vision, it depends profoundly, fundamentally, on systematically addressing these core issues. Trust, data quality, usability, integration. We can build all the fancy tech in the world, but if that foundation isn't solid, it won't truly serve us the way it could.
Absolutely. And I think this leaves us with a really important question for you, the listener, to ponder. As healthcare becomes more and more technologically driven, more tailored to your individual needs, how will you navigate that balance? The balance between the incredible convenience and insights it offers and the critical need to protect your privacy, ensure the quality, the integrity of your own health data. What part will you play in shaping this evolving landscape as it becomes really more and more central to all our lives? Something to think about. Thanks for joining us for this deep dive.